Hi everyone, and welcome to my video on whether using marijuana is good or bad for you. In this video, we'll be discussing the potential benefits and risks of marijuana use, as well as the factors that you should consider when making your own decision about whether or not to use marijuana. The potential benefits of marijuana has been shown to have a variety of potential benefits, including relieving pain. Marijuana can be effective in relieving pain caused by a variety of conditions, including chronic pain, cancer pain, and nerve pain. Reducing nausea and vomiting. Marijuana can be effective in reducing nausea and vomiting caused by chemotherapy and other medical treatments. Improving appetite. Marijuana can be effective in improving appetite in people with cancer and other conditions that cause weight loss. Reducing anxiety and depression. Marijuana can be effective in reducing anxiety and depression, especially in people with chronic conditions. Improving sleep. Marijuana can be effective in improving sleep in people with insomnia. The potential risks of marijuana also has a number of potential risks, including addiction. Marijuana can be addictive, especially for people who start using it at a young age. Mental health problems. Marijuana use has been linked to an increased risk of mental health problems, such as psychosis and schizophrenia. Respiratory problems. Smoking marijuana can irritate the lungs and increase the risk of respiratory problems, such as bronchitis and lung cancer. Cognitive impairment. Marijuana use can impair cognitive function, such as memory and learning. Driving under the influence. Marijuana can impair driving ability, so it is important to avoid driving after using marijuana. Factors to consider when making your decision. When making your decision about whether or not to use marijuana, it is important to consider the following factors. Your age. Marijuana use is more likely to be harmful to people who start using it at a young age. Your mental health history. If you have a history of mental health problems, such as psychosis or schizophrenia, you should be especially careful about using marijuana. Your respiratory health. If you have respiratory problems, such as asthma or bronchitis, you should avoid smoking marijuana. Your driving habits. If you drive, you should avoid driving after using marijuana. Conclusion. The decision of whether or not to use marijuana is a personal one. There are pot,